routine is normally like. So why don't you meet Harold? Let's call his name Harold. That's not his actual photo. Harold is a 65-year-old man with history of diabetes, high blood pressure, cholesterol. He's on a number of medications, and he also smokes. One day, at about 1 o'clock in the morning, he developed this central chest tightness, which radiated to his jaw and down his left arm, that is associated with sweats, heart racing, and feeling nausea and feeling really sick. Within about an hour, he rang the ambulance, and the ambulance guy came, did the electrical tracing of his heart, and discovered that he's got an acute myocardial infarction or acute heart attack. So our team was summoned, and we received a phone call around between 2 to 2:30, and we had to be in the hospital within 20 minutes. And sure enough, he hit the cath lab table, and this is his angiogram. Now this may not mean much to you, but basically he's got an occluded right coronary artery. How do I know? Because once I passed the wire, and you can see, his artery is actually much bigger than that occlusion. And over here you can see it. Do we have pointer, by the way?
Oh, I have pointer.
Yeah, we just wait. But by the way, if you just have a look in his artery there was like a couple of bubbly looking stuff underneath. That was all just clots that blocked his artery. And what we did, aspirated all the clots, balloon a bit of that occlusion, and then put a stent, which is a metal structure made of precious metal, and this is the end picture. He's a happy man by this time. Whereas when he first hit the table, he looked like he was about to die. And in fact, had we left him alone for some time, some of these patients indeed can develop cardiac arrest and eventually die. So that's really what we do every day. In other words, you know, when it comes to dealing with heart, there is no time of messing around. As I mentioned earlier, within 20 minutes we just had to be there, because if we let the occlusion to last for greater than 20 minutes, then the permanent damage is likely to be long-lasting rather than reversed. So today I have divided the outline of the talk into 3 parts. The first part, we're going to try to understand how our heart works. So this is going to be a little bit about anatomy, physiology, so welcome to medical class Cardiology 101. Why do I decide to start with that? Because I believe unless we understand how our heart works, how our heart is developed, how our heart is fashioned, we will not develop love, interest, and passion about the heart. And unless you appreciate this, then you will not be looking after your heart. Because you know what, most of you, or majority of us, we just go through with life not even aware that our heart is doing a lot of work. So therefore it is important for us to begin to appreciate our heart function. The second part of the talk, we're going to talk about coronary artery disease. Now, so I just tried to limit the scope of this talk into coronary heart disease. You know, I remember whenever, you know, my mom's friends or my dad's friends, let's say they died of a sudden cause, and I asked them, look, you know, what did they die, you know, from? And mom and dad always say, yeah, some kind of heart attack. And I said, Mom, Dad, obviously, if the heart stops, you die, right? So what kind of condition that led to his heart to stop, so to speak? Now, this is one thing that maybe not many of you realize. There's actually a whole swag of conditions of the heart. There is the condition of the arteries. There is a disease of the rhythm, or the electrical part. There is the disease of the valve. There is a disease of the muscle. There is a disease of the plumbing, etc. So heart is a very, very big kind of field. But for the purpose of today's discussion, we're going to focus only on the artery disease. Okay? And finally, I want to leave it to question and answer. I'll dedicate an hour for this. So feel free to ask me any questions that is related to this. Or if you have any questions related to medicine in general, I shall try to endeavor to answer. But if I don't know, I'll mention that I don't know the answer to that question. Alright, so let's begin by the first one, which is the mechanism of cardiac condition. So let's talk a bit about human embryology. Embryology is the study of how fetus actually develops within the woman's womb. This is actually quite fascinating. What happens is that, as you all know from the basic education, a child occurs when one cell from the woman and one cell from the woman, they meet together, they join, and then they start the process of division, right? And the cells from these two cells into one, they continue to develop into 4-stage cell, 8-stage cell, 16-stage cells, etc. Now, what happens by week 3 of this fetus is formed, there is a formation of 2 heart tubes. And through the process of what I call a fusion, separation, and folding, it becomes a cardiac organ. Now, do you guys know that heart is the first organ that reaches its full function during the fetal development? Now, that's quite impressive. By week 4, heart begins to beat at a rate of 65 beats per minute. At that stage, the size of fetus, which is not the heart, the size of fetus, by the end of the first month of life, is only 6 millimeters or smaller than a grain of rice. So imagine, right? Imagine in your mind that you, when you were in your mom's womb in the first month of life, is only the size of a 1 grain of rice, and yet your heart is already functioning. Now that's pretty powerful, isn't it? When you think about that, forget about, you know, when you see your baby, right, when it comes up. For those of you who have already had a baby, I remember when our first child was born, you know, that was, you know, I can never forget the first time I held her in my arm. But imagine in the first month of life, when you were still the size of a small grain of rice, the heart is already functioning. Now, what happens is that as the heart continues to grow, it starts forming what we call the cardiovascular system, or a network of blood vessels that is connected to this organ called heart. Now, I gave you these 2 pictures. The one on the left is what we call fetal circulation, which is the circulation that happens when you are still in your mom's womb. And then the picture on the left is the picture of your heart when you are born and continues developing. There are a few key differences here. The first one, when you are still as a fetus, there is a structure here called ductus arteriosus, which is a communication between your pulmonary artery and your aorta. The next structure that differentiates the fetal circulation and the normal heart is a foramen ovale, which is the partition between the top chamber of your right heart and the top chamber of your left heart. Now, why the structure is like this? Simply because when you are in your mother's womb, the baby's lungs were not yet developed. So all the oxygen exchange mechanism occurs through the maternal or mother placenta. So the baby, when they were inside the mother's womb, they didn't need the lung. The lungs were not yet developed. So as a result of that, the baby needs to develop a mechanism for an efficient oxygen exchange without necessarily inflate the lung. Now, as soon as the baby is born, what did the first thing the baby do? They cried. So when they cried and took the first inflated the lung to full. And when the lung actually became fully inflated, suddenly there is this change of intracardiac pressure. And when the intracardiac pressure changes occur, the left-sided heart pressure becomes more than the right heart. It closes this ductus arteriosus, it closes the foramen ovale. And then what happens at birth also, the prostaglandin, which is one of the chemical structures inside the body, also drop, and it closes this communication here in the ductus arteriosus. And the baby's lung become fully functioning to do the oxygen exchange program. Now imagine that all this process occur being determined just by pressure difference. And also some chemical signalings, a complex one that we are still trying to understand. That's pretty amazing, isn't it? Now what happens is that when this structure and that structure is not fully closed, then it becomes what we call congenital heart disease, which is beyond the scope of this talk. But I'm just trying to kind of help you to understand the difference between fetal circulation and the adult circulation. As the heart becomes bigger and bigger, it becomes like this. Our heart is actually a centrally located organ. In contrast to what people think, whenever I ask them, where's your heart? People point like to the left, right? Actually, it's not. Our heart is actually a centrally located organ. However, because of the process of folding, unfolding, turning, etc., the right side of the heart is more front than the left side, and therefore it appears as though it's kind of on the left side. But it's actually a centrally located organ. Our heart has 4 chambers. Now this is the cardiac MRI picture of a healthy 22-year-old girl. So there are 4 chambers. 2 on the top called the atria, and 2 on the bottom called the ventricle. So this is called the right atrium, right ventricle, left atrium, left ventricle. The right side of the heart is to bring all the bloods from the rest of the circulation to the lung to undergo oxygen exchange, and from the lung it goes to the left side of the heart to be delivered throughout the whole body. Now, it's quite amazing, isn't it, looking at the heart functioning like that in real life. Now, a few heart facts. Human heart weighs approximately 300 grams. So it's really not a big kind of organ. It's only the size of your fist. So I want you to raise your fist. Make a fist. Now, that is the size of your heart. Obviously, the bigger you are, the bigger your heart, right? But the children, for example, they have a smaller fist. Normal cardiac output at rest is about 5.5 liters per minute. And the heart pumps at a speed of approximately 1 to 3 kilometers per hour. Now this is, I mentioned again, at what? At rest. When you do exercise, our heart has the capacity to increase the cardiac output to up to even 8 times. So let's say if you do cross-country skiing, these guys actually elevate the cardiac output by 8 times. So imagine that, about 40 liters per minute. That's pretty impressive. If you actually make a mental calculation, therefore, it pumps approximately 8,000 liters of blood or 2,000 gallons of blood per day. Now, that's enough to fill 6 of these semi-trucks to its maximum fuel capacity. This is, what did I say? A day. Right? Every day, when your heart pumps at rest, enough to fill 6 of these semi-trucks. Over a lifetime, if you make the mental calculation, one guy, one's adult heart can fill the whole entire Empire State Building. So tell me if our heart is not